Good afternoon. Thank you for joining us on this Monday afternoon for our COVID-19 update and our local response. Joining me as we conclude the briefing for question and answer sessions today is Sheriff Mike Williams, Fire Chief Keith Powers, and Emergency Operations Center Director Steve Woodard. As of this morning, the Florida Department of Health is reporting 863 positive cases in Duval County, 75 hospitalizations, and 15 deaths. Our percentage of positive test results is currently at 5%. The data continues to show that our number of hospitalizations for COVID-19 patients in Duval County have been consistently well below capacity. For example, as of today, they are at 51% capacity. This appears to show the flattening that we've been looking for. One of the most important things in the path forward is increased access to testing. Here in Jacksonville, we are doing very well on that front. We are reaching the recommended milestones each step away as recommended by multiple studies, as well as the plan from President Trump to reopen America. For example, a recent analysis from researchers at Harvard University recommends in order to safely reopen our communities, we need to test 152 people for every 100,000 people each day. With an estimated population of 960,000 in Jacksonville, that would be just over 1,400 tests a day. We're taking necessary steps daily to reach that goal. We've tested more than 10,000 individuals at drive-through sites located at Lot J and Prime Osborne, and we are steadily increasing our testing capacity at Lot J. In addition, thousands more have been tested for COVID-19 at our local hospitals, other medical facilities, and through the Department of Health. This combined testing capacity puts us in excess of 1,500 tests per day. As we talk about increased capacity, I'm pleased to announce that within the next week, we will open another walk-up testing location on the north side of Jacksonville. This will be located at Kooker Park and will test up to 200 people per day. More details on this site will be available soon. This is important to assure that people in all parts of town from all backgrounds can get testing. The goal of testing is to identify and isolate individuals with a positive diagnosis of COVID-19 and track how widespread the disease is in the community. Milestones for a safe reopening also point to the percentage of positive test results. Again, we are already meeting this criteria. In Jacksonville, our percentage of those testing positive is holding steady at 5%. Well below numbers in other large metropolitan areas throughout the country. Last Friday, we opened Duval County beaches with limitations. As a reminder, Duval County beaches are open from 6 a.m. to 11 a.m. and from 5 p.m. to 8 p.m. for essential activities as outlined in Executive Order 2091 from Governor DeSantis. Essential activities include recreational activities consistent with social distancing guidelines like walking, biking, hiking, fishing, running, swimming, taking care of pets, and surfing. No sunbathing, towels, blankets, chairs, coolers, or grills are permitted. I've been in constant communication with law enforcement and the beaches mayors over the weekend. They report the community is responding well to the limitations and the guidance we put in place. I'm thankful to our local news outlets for their objective coverage of COVID-19 from the beginning to where we are today. They've been strong in the face of national and international news, running sensational headlinings without understanding our city. Thank you to local journalists for your objective coverage. In addition to the beaches, we also reopened public parks for normal hours, but I'll remind folks that my executive order limiting gatherings to fewer than 50 people is still in effect, and the Surgeon General's guidance is less than 10. We ask people in parks to practice social distancing and act responsible. Restrooms, pavilions, and picnic areas will remain closed, and no organized group activities will be permitted. As I said in my announcement last week, the limited beaches reopening can be a first step in a pathway back to normal, but we must be mindful of the risks and respect the limitations, not only for our safety, but for the safety of our neighbors as well. I would remind you that we remain not only under a local stay-at-home order, but a statewide stay-at-home order that Governor DeSantis issued weeks ago. A quick update for our partnership with ViStar. To date, approximately 326 loans have been approved for $11.5 million in relief loans. Each of these loans is helping businesses continue to run, keep people employed, and putting food on families' tables. Thanks again to Brian Wolfberg, Jenny Vipperman, and the ViStar team for your partnership in this effort. To the students in our community, I know that many of you, probably most of you, when you heard that you will not be going back physically to school this year, there's a lot of disappointment. All of the end of year activities, if you're a senior, the things that you're going to miss out on. I know many of you want to see your friends. I know my son and daughters at home have friends that they miss. Just want to say directly to you, I understand this is a very difficult time for children and young people of all ages. And I just hate that you have to experience this. I want to remind people to make that call at 7 p.m. tonight. The 7 o'clock call somebody, listen to them, share with them, connect with somebody, either a friend or acquaintance or somebody you just haven't talked to in a while. I also want everyone to be mindful of those struggling with depression, alcohol, and drug abuse, and thoughts of suicide in these hard times. If you know someone who has struggled with these issues in the past, please check in with them and let them know you care. We have a list of resources available on the city website, coj.net/recovery resources. The National Suicide Prevention Hotline is available 24/7 at 1-800-273-8255. With that, we'll take questions. Courtney with Action News.
Yes, Mayor Curry. So you mentioned that we've reached recommended milestones here in Florida. So in terms of reopening here in our area, what does that look like? Because you have a city in Texas, you have Houston talking about slowly starting to take steps this week. So if we've reached recommended milestones, we have beaches partially reopened, do we have a target date here in Jacksonville, and just what does reopening look like?
Well, the president's team, President Trump rolled out a set of guidelines that we're looking at and following. The governor is working on a plan to reopen Florida, which will be in collaboration with cities and counties. So we're going to follow those guidelines. We're going to work with the governor and his team. But once we get to, while we're there with testing, we're going to continue to expand testing. No city or county is the same. Whether it's in the state of Florida or in other places. So we'll take those guidelines and then we'll tailor it to what makes the most sense for Jacksonville. So look, everybody wants to get back to work. We don't have a set time, a specific date in time right now. We'll be closer to that probably in the days ahead as we work with the governor's office. Jim with WJXT.
Mayor, you're taking a lot of flack for opening the beaches nationally, as you had mentioned. Who were you in contact with to decide to do that? The surrounding communities were saying, hey, that took us by surprise. Did you talk to people in infectious disease control about the problems that this could create? Because, I mean, when we see this, there's lots of people out there, they are abiding by social distancing and the rules, but not everyone. Is there a chance you could change this decision?
If people don't adhere to social distancing and crowds get out of control, we evaluate these decisions every day. Look, I've been in almost daily conversations with the beaches mayors about what makes sense. From the beginning of this crisis, the governor, myself, and others have suggested that people get out and exercise and move around and do it in a safe way. If you'd been down to First Street any time in the last couple of weeks, the exercise on First Street, at times there were points that were getting pretty dense. In fact, a couple of weeks ago, I saw some crowds on First Street talk to the beaches mayors, and they started having people break those crowds up. So with our curve flattening, this was a very measured opportunity to open more space out there where people were already moving around on First Street. And look, Jim, I speak with physicians, the hospital leads, an organized call every week, and then informally I call them throughout the week. I've spent some conversations this weekend. Until we have a vaccine, physicians are going to say the answer is to stay at home. And if I were a physician, I'd say the same thing. But we're not going to have a vaccine, we believe, in a month or 2 months or 3 months. So people can't just lock themselves in homes and not go back to work. They need money for their families. They've got to take care of their mental health. They've got to take care of other medical issues. So we as a community are going to have to, as long as this virus is around, as long as we flatten the curve, we're going to have to figure out how to mitigate the risk and be smart about it as a community. We're not going to be locked in our homes months from now. That's just not feasible. It's not practical. So we as individuals have to take personal responsibility for our behaviors, social distancing, wearing masks in grocery stores. You go to the beach to walk or exercise. If you go in your neighborhood to walk or exercise, same thing. We are going to have to be very disciplined about our behaviors. Kelly, WJXT.
Hi, this is a question for Chief Powers. There was a memo sent out by Information Services in early April regarding information sharing between the State Health Department and first responders in Jacksonville. My question is there an issue with the state not providing complete data to JFRD and dispatchers? And what data is the city currently receiving? What more is needed from the state for first responders to do their jobs safely?
Good afternoon, Kelly. We received data from the Florida Department of Health through the Duval County Health Department on a daily basis. There's a dashboard that we use to get our information from. They share the information that we need to provide to our first responders, flagged addresses and stuff, so we can make sure our first responders are wearing the appropriate protection when they get there.
What was the memo regarding? Why was it sent in the first place? It seemed to assert that there was an issue with information getting to you all.
I think initially we had some gaps in the information being shared, but the Duval County Department of Health is correct in all of that.
Ann with First Coast News.
Morning, Mayor. I wonder if you are, I know that you're concerned about the health safety of people locally, but I wonder if you could comment on any concerns you have about the reputation of the city, sort of, unflattering hashtags trending this weekend. I'd also like to get from your first responders there an update on the either number or percentage of their staff sidelined by the virus.
Yeah, I'll start. I'll take the first part of the question. And we got out early in terms of closures, and we took some flack, certainly not the kind of flack we took nationally and internationally this last weekend. But here's my commitment to the people of Jacksonville. I'm not going to make decisions based on how I think. Critics outside of this city or certain news outlets are going to react and talk about us. Certainly would like to mitigate those stories so they don't just, report all kind of lacking objectivity and just certainly would rather not see that happen. But when we move to the next phase, whoever decides to open, for example, certain businesses with certain restrictions, certain media outlets outside of a city are going to do the same thing. And so I didn't like seeing it, but I will make decisions based on conversations with the science, the doctors, and how we get back to work in a way to mitigate risk and encourage people to practice the behaviors that we need to practice. Chief Powers.
Yeah, thank you, Mr. Mayor. Yeah, we have about 1.8% of our workforce that's still out related to COVID patients. That's about 29 people. That number is a lot better than it was into last week. We've continually been getting people back every day, and tomorrow we'll get another 15 back, so that number will be down to about 14.
Hey, Ann, this is Sheriff Williams. So we have 7 people right now that are either isolated because of exposure or having symptoms. That's corrections and the sworn side combined. And in the jail, still no confirmed cases, and we have about 4 inmates in isolation under observation right now.
And Ann, I would just add too, as I said before, no city or county is exactly the same. For example, clearly Jacksonville is not New York or Seattle in terms. Just think about population per square mile. My understanding is New York City has Central Parks open. Their subways are running. I'm not judging that. They're making nor is our local media judging that. They're making the best decisions they have with the information they have. I just don't think it's healthy for people outside of our city. I don't think it's wise. I don't think it's responsible to mock decisions being made by people that are taking this stuff seriously. Sky with WJCT.
Hey, Mayor, just wanted to follow up on that. You thanked local journalists in a tweet, and you just thanked local journalists now. What would you say on the outside was, from what you saw in national media and things, was sensationalized or inaccurate? And my second question is just about, is there an update on the team that you are assembling for reopening the city? Thank you.
Sure. Well, while it would be tempting for me to get into a back and forth with certain cable news outlets, I'm not going to go there. That there's no value in that. Doesn't add anything for the citizens of Jacksonville. So I'm moving on and going to focus on how we best move forward with testing and getting Jacksonville closer to the ability to get back to some sense of normalcy. And then what was the other part of the question?
Just asking about the team that you said you were assembling last week.
Oh, yes. Yeah, so what I talked about last week, let me just clarify a couple of things. Not a task force, could result in a task force at some point, likely will, but a small group of folks that I can get on the phone with and talk to about some of these things that have business and healthcare backgrounds. I am close to finalizing that and being able to share with you guys and the public who those individuals are. And look, the reason I'm going to share who those individuals are is because I go back to when all this started and I was talking to hospital leads and doctors. You guys were asking, who are you talking to? So I just think it's good on the front end to lay out who these initial discussions will be as we work with the state and the feds to get back to some sense of normalcy. So stay tuned. I would expect this week. Mike, Daily Record.
Yes, hi, Mayor. Kind of piggybacking off of what Sky was just talking about. Can you maybe elaborate a little bit more about what the duties and responsibilities of this group of leaders are going to be that you're putting together? And then can you maybe, you said a small group of people. Can you elaborate a little more on the size and the makeup of the group you're trying to assemble?
Yeah, business backgrounds, government, and the ability to collaborate. And so here's the goal. What can the city do? How can we collaborate with all independent agencies to figure out how to expedite projects that we're going to have to do? That's a question. Another question is, how do we not only meet the minimum thresholds of testing, how do we ensure that we can at some point turn that testing around rapidly? And should we maybe even do more testing? The other piece is collaborating with the companies in town, making sure that businesses aren't operating on an island, big and small. So you take our big fortune companies in town. We want this group be collaborating with them. And that's where this could potentially turn into something more formal and potentially a task force where you'd actually see people from business and other expertise on a larger group. So this is just some sort of informal ability to talk through these things, which is what I've done with the hospitals as this pandemic started. Ellen, Jack's Business Journal.
Yeah, good afternoon, Mayor. I was just curious if you could provide some clarity in terms of taking a more incremental approach to reopening the city. What are the next steps going to look like? And then also, could you provide any details around other plans for additional help for businesses?
Well, the next steps, look, we've got to work through the specifics, but there will be a move to opening retailers, to opening restaurants at some point. Businesses that were not deemed essential. Big things we're going to have to talk about. Look, I foresee people that work from home should continue to work from home. That is going to be my recommendation. I have no doubt that when we start to move, I'm going to recommend that if you can work from home, you ought to be working from home for a period of time. We're going to encourage the use of masks when you're in the workplace or grocery stores. And we will consider, you got to think about things. the number of people that can be in a building, whether it's a social building, which is a restaurant, or a workplace building. Those are the kind of things we're talking about. Don't have specific answers on those right now, but likely we'll move incrementally with those things in mind and with very specific instructions for people and businesses. If you have entry points, for example, at a social place, how do you guidelines to manage where people aren't standing at a gate, 50, 100, 150 deep, mushed up together? So those are the things we're thinking about that we will put guidelines out on as we move towards another step towards a reopening. And look, we all wish there was a vaccine right now. We all wish that this virus wasn't here, or that it would be gone tomorrow in a month or 2 months or 3 months. But based on what we know, that's not going to happen. So I just want to reiterate to people, the virus is here. We flattened it here. We are going to have to, but we can't stay locked in our homes indefinitely. It's just not an option. There's a whole lot of fallout that's already happened from that. And it's only going to get worse the longer this goes. So what I need people to do is to take social distancing seriously. Like people ask me about the beaches. I still walk in grocery stores sometimes and see groups of people walk in that didn't come in together, and they're congregating face to face. It's not often, but it's happening. We are going to have to really think and be focused and disciplined about our behaviors. And then we can go back to a sense of normalcy and mitigate the risk. Courtney with Action News.
Yes, hi, Mayor Curry. Okay, so we know that health experts overall are saying that we need to increase the ability to test people rapidly before we can open safely. So here, I just want to know, when are we going to get more tests? Do we know how many we're getting for our area? And where are they going to go? And are results coming in faster?
So I mentioned earlier on the call, we are adding another testing site on the north side. In terms of the ability to rapidly turn around, we're pursuing that. And there is the ability to do that in here with a local hospital. So we're going to, as we work towards a reopening, work towards the ability to turn tests around rapidly. Director Woodard, would you like to add to that?
Yes, Mr. Mayor, thank you. Obviously, what we've been able to do is leverage the assets of the federal government and the Health and Human Services, and then with our state partners, with the National Guard, and with the private sector, with the testing at Prime Osborne and Mayo and other hospital facilities. So we're leveraging every source that we can. To date, in Duval County, about 17,000 tests have been conducted, and that is a good number based on the president's guidance.
And I would add to that, just to remind people that we were one of the first in the state to get our testing up and running. We moved very aggressively on that. And we've continued to expand our testing even since we started, and it will be again this week. And that our testing percentages remain around 5%, which is lower than metropolitan areas around the state. Jim with WJXT.
Mayor, lots of questions are coming in from viewers. One being the status of libraries. They say with schools remaining closed and with parks now open and the beaches, is there a chance we could see something happen with libraries? Another viewer wants to know the status of the inmates at the jail. Have there been any positive cases? Basically, those are the types of questions coming in. And then another question on the beach is when people are standing still, not walking, are they being told to get off the beach?
A couple things. First part of the question was libraries. Jim, whether it's libraries or the zoo or any city facility, we're always considering when we can safely resume some level of business or access. There's not a timeline right now. We have talked about it some of this stuff as recently as today. And then before I go to inmates, there was a last part of that question. Yeah. Oh yeah. So fire rescue, local police at the beach are, if people stop and congregate, they're being told to move. Absolutely being told to move. Sheriff?
Yeah, thanks, Mayor. So, Jim, inmates in the jail. So we have about 4 inmates right now that are quarantined. That number has fluctuated anywhere between 2 to as high as like maybe 15 at one point in time. So obviously we have the ability to put those inmates in a negative pressure cell. It is designed for infectious disease, and we stay in that posture all the time at the jail anyway. And currently no positive cases at the jail. And we have, I believe it's 4 corrections officers right now that are quarantined either because of exposure or they have symptoms. And that number has fluctuated as well. So we have been very fortunate in the jail operations.
Kelly with WJXT, this is the last question.
Hi, I'm going to follow up with Chief Powers on my earlier question. You mentioned that the memo was sent out because there were gaps in the data earlier. What specifically were you all not receiving that you are now? When was it fixed? And do you believe that the lack of information initially led to any of the first responders having to self-isolate or quarantine?
Kelly, I don't believe anything led to anybody having to be self-quarantined. You know, this was a new process for all of us. You know, this virus was bigger, you know, something we had never seen before. And obviously when you're first starting off, there's going to be gaps between the information that we need and the information that they're sharing. But they were the Duval County Department of Health has worked with us hand in hand to make sure we're getting what we need. And that's helped, you know, that helps us to be able to provide the service to the citizens that we serve.
I would just want to add to the question I got about local journalists and me thanking them for objective coverage. To be clear, it has been objective without opinion. I saw reporting this weekend. I didn't see a single journalist, any media outlet saying they agreed or disagreed with the decision. They simply reported the facts. And that's what you guys have done through this whole process. I was sitting here thinking about the original work from home order. Every briefing I did for days after that, you guys were grilling me on the work from home order, how you monitoring, how you capturing the complaints. And that's the right thing to do. My point is, I'm grateful that in this very serious time, as we all work through this, that local journalists from all venues, from what I've seen, are reporting the facts as they see them. And that's what the public needs to know. That's why we're here today, and that's what we're going to continue to do. Thank you.